Our next speaker is Caitlin Childs. Her talk is called Intersections: How Disability Can Inform Intersex in the Classroom and Beyond. Caitlin has been active in social justice movements of various kinds for half her life. You have to guess how long that is. She's been an intersex activist for 10 years and frequently speaks to diverse audiences on the topic. My first introduction to intersex was actually an Intersex 101 workshop that Caitlin did at the Feminist Bookstore in Atlanta, Georgia in 2004. Now she works in the field of developmental disability and is especially interested in the ways disability and intersex intersect and how we can build off those intersections. She has a website which you can link to from our Facebook page with lots of good stuff on it, good resources for if you're thinking about adding the I. She is published in Visible, a femthology, and she is also, along with Linnell, featured in the documentary One in 2000 and the recent documentary Intersections, which I haven't seen yet. So here's Caitlin.
Thank you for having me. I'm really nervous and excited. I usually do Intersex 101, so I'm thrilled to not be doing an Intersex 101. I get kind of tired of the same old, so it's really exciting for me to get to talk about something else that I'm like totally nerding out about right now. So what I hope is that we can together explore different ways of talking about and thinking about intersex that draws both on disability and queer studies, but I'm really going to focus on intersex and disability. I'm going to talk some about language and identity. I'm going to talk about medicalization and normalization. I'm going to talk about paternalism and professional and parent-driven decision-making, and then kind of what the implications of all of this are and what we can do next. So for me, connecting my experiences as an intersex person to disability has been really helpful. And it's raised a lot of ideas and conversations for me. And so I want to think about this more. I'm just thinking about it. I don't have any answers, just questions that I'm excited about nerding out over. And then kind of explore this more, intersectionality and then cross-identity alliances. So a little bit about myself and my story. I was born and labeled the box female, was checked off, sent home. When I was 15 years old, I had been physically developed, had gone through puberty, but I had never begun to menstruate. So I ended up going to a doctor to make sure everything was okay. The doctor thought I had something called an imperforated hymen, which is when the hymen is thicker than is common. This actually can be dangerous because if you're menstruating and the blood has no way to exit the body, this can obviously cause issues. So they said that's what I had. I was scheduled for a very easy in-out, put me under anesthesia, cut my hymen, send me home, the end. When they went to cut my hymen, they realized I did not have a hymen. I had been born. The condition I was diagnosed with is called Meyer-Rokitansky-Kuster-Hauser syndrome, MRKH. I like to say it's named after the dead guys who discovered it. And what this means is that I was born without a vaginal canal and without a uterus. It was very traumatic when I was diagnosed, one, because they cut my body. If they had done an ultrasound, they could have avoided this whole thing. But also, the gynecologist who did the surgery had no bedside manner, because she usually works with people under anesthesia. I was told as I was coming out of anesthesia in a recovery room by myself that this was what had happened. And it was pretty upsetting. I mean, I was 15. Sure, we all remember being teenagers and kind of figuring out who we are, our sexualities, our bodies. So it was pretty upsetting to me to find this information out. I really wasn't concerned about not being able to have kids. That was my family's concern. For me, I just felt like a freak. I felt like if people knew, they wouldn't want to be with me. It was very painful. I did not have any type of surgery or treatment upon my diagnosis, treatment with quotation marks, not because anybody ever offered me that as an option to do nothing, but because I just psychologically, emotionally could not deal with this information. From 15 to 18, this was a secret. I was sexually involved with people and I didn't tell them. That made it really hard to be sexually present because I was always trying to avoid penetration, and I was too scared to just say, you know, I don't have a vagina, that's not an option. When I was 18, you know, Linnell talked about the importance of folks getting up here and doing this. When I was 18, I went to Queer Eruption in San Francisco, and I completely by accident stumbled upon an intersex workshop. No one had ever given me the word intersex. I had not heard that word in connection to myself. And kind of similarly, you know, Linnell talked about this video or this news program she had seen. I was sitting in this room, and it was Hida and Thea Hillman and a couple of other folks in the Bay Area, and they all told their stories, and none of them had MRKH, but the similarities, I was just in shock. I mean, I felt stupid. How did I not know? But that was actually the best gift I ever got, was stumbling upon this workshop. I talked to one of the speakers afterwards, explained my situation. This person didn't know much about MRKH, but encouraged me to go home and research and explore. The word intersex changed my life. I'm really attached to that word because that was when I started to get angry. I had gone through, like all intersex people talk about, multiple genital exams. I went through many, many people looking at my junk. I went to Emory Hospital. I'm from Atlanta, grew up there. I went to Emory. Medical students, as well as the doctor and the nurse, looked at me at 15. Which was not a pleasant experience. So the word intersex helped give me the room to be pissed. It helped me kind of feel like I wasn't alone, that I was connected to a bigger group of people, not only in terms of like not being the only one, but in terms of gaining a political analysis around the things I had experienced, and that was huge. So I started doing intersex workshops. The first one I ever did was with my partner at the time, who is trans, who was an incredible ally to me. My personal experience has been that the trans community has been very supportive of me and very helpful for me to help articulate my experience and think about my identity. So my ex, Seth, and I made him do all of my early workshops with me because I was so terrified to be alone. And the first workshop I did, I think, was at the Southern Girls Convention in Athens, Georgia. And that was kind of the beginning. It was so empowering for me to get up and tell a group of strangers something that I had been so ashamed of for so long. That was huge for me. For my job these days, I work for a developmental disability agency. Part of the reason I got interested in disability work was because I felt a connection to a lot of the experiences that folks who are disabled have. My job, I am a community organizer. I have 7 community organizing projects around the state that help connect folks with developmental disabilities, particularly people with significant intellectual disabilities, to the larger community. So that's kind of what I'm doing these days. So to kind of move in to the rest of things, first I want to talk about language and identity. So for me, I think of both intersex and disability as being large umbrella terms that encompass a diverse range of medical diagnoses. And all of those share the commonality of being treated and viewed under the same medical model, as well as carrying similar social stigmas. Folks who fall under this umbrella technically, and by that I mean legally and medically, don't always identify as disabled or intersex, but again, we're kind of facing the same things regardless of how we self-identify. I know that when ISNA was founded, a lot of the strategies had kind of been drawn from watching the disability movement. I need to give a shout out to my friend Bethany Stevens, who is an amazing disability studies scholar. in Atlanta, who's a good friend of mine, who also helped me a lot with this talk. And she's really interested that kind of the disability movement and the intersex movement have been kind of parallel. Most people think that the ADA in 1990, the passage of the Americans with Disabilities Act, was like when the disability movement started, when in fact there was about 20 years of organizing that happened before that. So for the intersex movement to have been founded in the 90s here in the US, we're still pretty young. So this is the beginning for us. In both the disability world and the intersex world, there are really heated battles around language and labeling. Which words are more empowering and which words cause less stigma? As an example, in the disability world, there's a lot of talk about people-first language. So that would be saying a person with a disability instead of a disabled person, putting the person first. Or also, another, some folks who are disabled use the word CRIP or GIMP. So many disability activists and scholars identify strongly with the disability community and are critical of people-first language because in my experience, a lot of the adamant insistence of using people-first language really comes from parents and professionals who want to distance themselves from their loved ones with disabilities or the people with disabilities they're serving socially and lingually from disability. This happens in the intersex world too, as we've already discussed, disorder of sex development. Some, mostly parents and medical professionals, seek to focus on disease in order to gain access to cures in the form of both research dollars and surgical, hormonal, and gender normalization, not only curing the person, but society of a social problem that challenges binary sex, gender, and heterosexuality and heteronormativity. Something I've been thinking about lately, again, I'm just thinking about this, is I've been wondering, is queer, so, for me, I'm queer identified, and to me, queerness implies that there aren't two of anything, that we exist on spectrums, whether it's sex, gender, or sexuality. And then, so I've been wondering, is queer to LGBTI, that DSD is to intersex and hermaphrodite, and that CRIP, GIMP, and disabled, or identity-first language as opposed to people-first language, if those are kind of similar. So I don't know. I mean, obviously, language and identity are highly, highly subjective and personal. Generational differences, as one's own personal feelings and experiences, are going to inform the terminology that they choose to use. To get back to the LGBTI briefly, I'm not going to really talk a lot about this, but I really have come around about that. When I was first coming out as intersex, I too was really frustrated as one of the audience members talked about a lot of organizations have the I, but they don't really know what it means. And that used to really piss me off. In fact, when I was younger and more obnoxious, I used to call organizations and say, hey, you have an I, what are you doing around intersex? And I was disappointed that a lot of them didn't know what it was. I've come around about this. Homophobia and the need to reinforce these binaries of sex and gender is a big reason why interventions happen on intersex people in the first place. So you can't separate homophobia from intersex surgery. And success in the eyes of those who perform these interventions is heterosexuality. I would be a success if I had surgery and I had a vagina that could accept a quote-unquote normal penis. That would be considered a success. To go back to that a little bit, I didn't have any interventions initially, I said, because I just emotionally couldn't deal, so I just shut down. When I was 18, I made a very conscious decision to keep my body as it is. So I have not changed my body. And that was a very rebellious choice on my part. And part of me coming to accept my body and love my body. I think there is something inherently queer about intersex people. Heterosexuality requires the binary. So when our bodies don't fit into these two boxes, to me there's a kind of queer space that exists there. So that's another reason why I'm supportive of the I. I'm going to talk a little bit briefly towards the end about some strategies around doing that well, because I think it can be done well. So medicalization and normalization. So like lots of intersex folks who are physically disabled are often subject to invasive medical interventions and normalization procedures. For example, surgeries and painful physical therapies are routine for folks who are physically disabled, generally to maintain or gain the ability to walk more normatively. Parents are pressured by medical professionals in early intervention programs to detect difference. In the case of autism, many folks I know who are autistic talk about the trauma of therapies they were forced to endure to make them seem less autistic and more typical in their social behaviors. An example of this is stimming. If y'all are familiar what stimming is, it's a behavior, medical professionals would say, that a lot of folks with autism use as a self-soothing technique. And it's deemed socially inappropriate. So a lot of autistic children and young adults are put in therapies to get them to stop the process of stimming. There's a very infamous center, the Rottenberg Center, that actually uses shock therapy as one of the methods to make autistic children less autistic in their behaviors. I think it's kind of interesting to tie that to John Money. I'm sure many of y'all are familiar with John Money. John Money is who we have to thank for the standard of intervention that intersex people experience. And I'd say there's kind of a connection there when you think about John Money advocating for surgeries that have removed the sexual capacity and pleasure from many intersex people who've been subject to them. One thing that I have been struck with time and time again with my work in the disability community is that many of the folks I know who are disabled share similar feelings and experiences when it comes to the medical profession. We share the experience of being told that there is something intrinsic about who we are that is wrong, that is disordered, that is defective, freakish, repulsive, and in need of erasure, and that no one will ever love our bodies. So I was really struck time and time again that although our experiences were different, we kind of had this common ground. In terms of bodily integrity, agency, and consent, both people who have intersex bodies and people with disabled bodies, when you look through old medical textbooks, you will find pictures of us with black boxes across our eyes, somehow providing some sort of anonymity, but using our body, putting our bodies on display as if we are part of a freak show. Many folks who have been through these types of medical interventions throughout their life have post-traumatic stress disorder as a result. We feel like our bodies aren't ours, they're subject to the gaze of the medical world, and we feel like freak shows. Surgery is used, and it doesn't often do this, but allegedly surgery is used to erase our normative bodies. This doesn't actually really work. And it's hard, even someone who's been subject to surgery on their bodies, on their intersex bodies, or on their disabled bodies often bear the scars, and you don't really erase our intersex or disabled bodies. In terms of eugenics, to this day, 90% or more of pregnancies that are given a Down syndrome diagnosis are aborted in the US and the Europe and UK. In terms of intersex, there's a drug now called dexamethasone that is, there's been a lot of this in the media lately. I don't know if any of y'all have seen this, but there's an intersex condition called CAH. This drug has now become standard to use when a parent is carrying a child that is identified as having CAH, using dexamethasone to prevent the masculinizing effects of CAH. It doesn't actually make CAH go away. It just makes the body less masculine because CAH masculinizes the body. So I think that that's really interesting. So in terms of kind of the professional worlds and the amount of control that parents have, So with both intersex and disabled folks, parents are given complete control over their children, and medical professionals most often provide unbalanced information of living as intersex or disabled. By instilling fear and hysteria in parents, these professionals violate body integrity and fully informed consent of the child, or in the case for many of those living with intellectual and developmental disabilities, it happens to adults too. To come back to DSD, disorders of sex development, in 2005, there was a quote-unquote consensus meeting where a group of mostly professionals, my understanding was there was one intersex adult present, came together and decided that intersex was no longer going to be used, and we were now under this umbrella of disorder of sex development. The mindset of using pathology lessens social anxiety because it frames intersex and disabled folks as objects that can be cured of deviancy and difference. By taking on an identity of other, intersex or disabled, social order is disrupted. A lot of the arguments for DSD include insurance, so access to so-called treatment. So, you know, there was some pushback, like maybe we could use variants, because a lot of people really, you know, the intersex movement was about saying we're not disordered, there's nothing wrong with us, right? So like saying DSD implies that we are disordered, and then when you have a disorder, you need medical treatment. So a lot of this has been, you know, to get access to, so insurance companies will cover surgical interventions, hormonal interventions, and then also research dollar-based arguments, which I think is really interesting and ties all of this into capitalism. I personally am terrified of researchers. There's a recent NIH grant to MRKH, they don't know what causes it. And there was a recent call for participants to be in the study to try to figure out what causes MRKH. And I very strongly decided not to participate because that scares the crap out of me. I don't wish that I had never been born the way I am. And I know that wanting to find out the cause of MRKH is only going to lead to interventions to prevent it from happening, like CAH. And the use of dexamethasone. Similar battles I've noticed are happening in the autism world. Autism Speaks, which is an organization I'm not a fan of because similar to the group that decided that intersex was not the word anymore, it's a bunch of folks who aren't actually autistic making decisions, mostly parents and professionals making decisions for a community they are not actually a part of. But a lot of the battles in the autism world about changing the autism diagnosis have been around access to treatments, again, so insurance companies will cover so-called treatments, and also access to research dollars again. I had an experience that really struck me. My organization is overseen by a council, like our board of directors, and we have quarterly meetings. Atlanta, there's a place called the Marcus Institute, which is an autism center, very famous center. The speaker was, I can't even remember his name, but he's really famous, guy who specializes in autism treatment, and he gave this talk, and I was just mortified. I mean, I was violently shaking through it. One thing that really disturbed me was he showed us clinical footage of a small child who had been given an autism diagnosis, and he was showing us footage of her interacting with her social environment to show us how autistic she was, and it just triggered me because I think, you know, this small child certainly didn't consent to this video being taken and shown around the world to show how autistic she is, and it just reminded me again of so many intersex people I know whose bodies have been photographed and then used in textbooks. So that disturbed me. But he also talked a lot about curing autism and preventing autism. So after this talk, I went up to my boss and a couple of council members, both who happen to be parents of autistic children, as well as another professional in the field who mostly works directly with folks with disabilities. And And we had this conversation, and I was like, was anyone else really disturbed? And they were like, well, what was your problem? So I started to articulate these different things. And one of the parents freaked out, and because I was basically talking about a social model of disability versus this medical model. And he said, he's very involved in Autism Speaks. And he said, well, this is the same argument that's preventing me from getting access for my daughter to get the therapy she needs to be more normal. And everybody, my boss and these two parent advocates thought I was out of my mind, and the other person who works mostly directly with disabled folks pulled me aside and said, I understand where you're coming from. And I think there's this disconnect that happens because parents want to protect, they want their kids' lives to be as easy as possible, so they often end up, I think, way overstepping the bounds of what they have the right to do. And then professionals obviously need things to fix, and they've been trained from this medical model view of disability. And so I was really struck that I think folks who actually are more in community and in relationships, peer-based relationships with disabled folks who work in the disability community have a dramatically different view than parents and professionals. Also in the developmental disability field, a lot of the professionals are also parents, so that definitely causes some tension. For me, this really raises two questions. Who are the real experts? Are they parents? Are they people who went to school and got a fancy piece of paper saying that they're an expert in this area? And who gets to generate the truths around disability and intersex? So those are two things I'm thinking about. How am I doing on time? I'm like totally rushing, aren't I? Okay. So to come back to the LGBTI, I say yes to the I, as I articulated before, but I think it has to be done right, and it has to be done in a way that isn't tokenizing. To me, I was just talking to David about this outside. To me, if an organization has an I, to me that builds in a piece of accountability. So if you have an I in your organization and I call you and ask you what you're doing around intersex, you should have a damn good answer, and if not, you should be pushed around that. I don't think there's anything wrong with adding the I, again, as long as that organization is not just adding a letter to the alphabet soup, but actually making a commitment to do work around intersex. So that's my personal opinion on that. I also am really interested in the disability justice movement, which really focuses on intersectionality and centers the voices of folks who experience multiple forms of oppression. I wonder what we can learn from that in the intersex world. I do I'm not an academic at all. I just like to pretend I am sometimes in these contexts because I like to be nerdy. I have lots of great friends who are academics, Angie being one of them, who regularly invite me to their classes and bring me in as a speaker. And so I am really interested in how intersex is taught, and I think about this a lot. In Atlanta, I am one of two people who does this work, and probably I do this work most visibly. And it's hard because sometimes I feel like a token. I definitely have had people been like, we need the intersex person. And sometimes that's kind of weird. I've had to step out of this work sometimes to take care of myself. But again, because it changed my life to hear someone else telling their story, I want to be able to do that. I also have had the experience of people pulling me aside at the end of a workshop, crying, saying, I'm intersex, I've never told anyone before. And so that's really powerful. So in a teaching context, I think it's really important not to just use intersex to quote unquote prove that sex and gender are social constructions, because that totally removes the personal experience. And it makes us seem like we are theoretical, mythological creatures. I think I encourage teachers to introduce intersex as a standalone topic, and always, 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 if possible, have an actual intersex speaker come to your class. If for some reason that isn't possible, I think using readings for your class that are written by intersex folks themselves, and please stop using Anne Fausto Sterling's Five Sexes, please, please, please. That seems to be the standard reading, and I think it's a really problematic reading. She was challenged very heavily around it. She actually wrote a follow-up article, but it seems like most people in a women's studies classroom, I don't know if y'all all have like a place to go get readings, but it seems to be the default one. Don't use it. Again, really try to find stuff written from actual intersex people. In my opinion, those of us who have experienced this are the true experts. It's good to have allies who are intersex, but I think really centering the voices of people who actually experience this stuff is imperative to doing it right. And I will say also, even for scientists who think that firsthand narratives are somehow biased, I think that's a load of crap. We all have biases. Scientists are not unbiased. We all are socialized and grow up in cultures that teach us certain things, and we have to unlearn that stuff. So I don't think there's anything wrong with using firsthand narratives in a classroom setting. Also, participatory and community-based research in which your questions, organizing, and interventions are based on the actual needs and voices of the community itself, as opposed to perceptions based on stereotypes and originating from medical interventionists. Oh my God, I rushed so much. Okay, we're gonna have plenty of time for questions. So just to kind of close up, I think the idea of normality is a farce. It doesn't really exist. Most of us will experience disability at some point in our lives, and I think most people I know have never really felt like they are the perfect, quote unquote, perfect man or woman. Our experiences, our bodies, our lives are way more complex than that, and the standard of normality, again, I don't think it really exists. And so for me, I'm really interested in how different types of oppression intersect and overlap and share similarities. I think that's a huge starting point for organizing. The intersex world often feels so small. If you watch some of these documentaries that we've talked about, you're gonna see a lot of the same faces. We need all the allies we can get. And I am more than happy to embrace any group who really thoughtfully, intentionally wants to work around intersex, because like I said, we're a small community. We need all the allies we can get. So, thank you. Sorry I talked so fast. And I'd be happy to answer questions, or if you have any thoughts on any of the stuff I said. Like I said, I'm like totally nerding out and want to think about this with other smart people, so.
Start in the back here. Hello?
Hi.
Hi.
I really appreciate what you talked about, because I was really involved in Best Buddies in high school, and we were always taught that people first language was very important, and that was something that I tried to teach other people, so it was really interesting for me to hear another perspective. Mm-hmm. And also similarly, in two separate gender studies classes that I've taken, the token intersex work has been Anne Fausto Sterling's Sexing the Body, I think it's called. Right. And so I was just wondering if you could talk a little bit more about what you find problematic about that work, other than the fact that it's written by someone who's not a member of the community, and just, yeah, elaborate.
Okay. I read the whole book, Sexing the Body, when I was 18, when I first was coming out as intersex. The article that's often, the chapter in that book called The Five Sexes is the one that I find particularly problematic, and a lot of other intersex folks are really critical of. Because she proposes that there are merms, firms, herms, males and females, that there are actually 5 sexes instead of 2. I think sex, like gender, is a spectrum, so I think it's kind of problematic to say there are 5 and divide them that way. And a lot of people also felt like the language was kind of flippant and offensive. I should address that too. I think a lot about, so, you know, there's intersex, now there's DSD, and there are folks who call themselves hermaphrodites. And HEDA actually really pushed me around this. So I used to tote the party line that hermaphrodite was an offensive, problematic, and antiquated term. I think there are, I don't personally identify with it, but I know a lot of folks who find that word really empowering and like it. I also call myself queer and a dyke, and I have people within my own community who oppose that language. And then in the disability world, with the people first language, particularly where I work, we use people first language. So you might notice that sometimes I use it. It's because I have to kind of switch my language as I move in and out of different worlds. But what's interesting to me is that there aren't many folks who are actually disabled who work in my field. And a lot of the folks who have said, I'm disabled first, I'm a CRIP, I'm a GIMP, have been folks who are actually disabled, and the folks who are saying, no, that language is oppressive, you can't use it, are folks who aren't. So I think that's kind of interesting to ponder. So, did I answer your question? Sorry, I can ramble when I'm nervous.
Hi, I just wanted to say thank you for coming. And also, I have a question regarding how the disability rights, I know that the disability justice movement is emerging, but in terms of people who are very involved with the disability rights movement, I'm wondering what can be done to support people with intersex conditions, but especially children, to protect them from mutilation against their bodies. I do see some parallels. I'm not sure if you're familiar with the Ashley treatment, in the fact that, you know, the child does not consent to what's being done to them, and what the disability rights movement can really do to usher forward an agenda to support intersex people.
That's a great question. I mean, this is something I'm thinking a lot about, especially as my job is all about disability. And I mean, I think, you know, pushing back at medicalization and normalization, that's like an area that we can come together really well. I mean, I think in terms of intersex, you know, there's kind of been like two things. There's been folks working with the medical community to try to change the way that intersex is handled when an intersex diagnosis is made, and that's really important work, and some work that I've been involved in at Emory is talking to medical students. So that's one piece. But then the other huge piece is just visibility and educating people about what intersex means. I don't know, I've thought lately, like, could there be a way that we could get some folks together from the disability community and the intersex community and kind of put our heads together around how we might support each other better. I, by accident, kind of fell into disability work and then have been making these connections, but haven't really known how to move it forward. So I don't really have an answer. I think there's a lot of space there, and I would be more than happy to work with anybody who wants to start thinking about that more. But yeah, there's so many similarities.
Okay, so then I have a second question. And that would really be in regards to what is, for the intersex community, I noticed the previous speaker said that we don't have a disorder. And I know a lot of people with disabilities would also say, I don't have a disorder. And I'm wondering what you think, or what's going on to sort of bridge the commonalities between the two communities, without necessarily, you know, sticking a disabled label on somebody who doesn't want one. I identify as disabled, and I identify as CRIP, so that's one thing, but I think everybody has the choice to identify however they want to. But I had done a little bit of research before I came here, and it just seemed like the intersex community really wanted to distance themselves from the disability label, and I was wondering, how can, you know, disability rights even try and help protect these children when the community is distancing themselves from...
Yeah, you know, I think, I mean, it's complicated, of course. Again, it's identity, so that's really messy and varies from person to person, and I certainly cannot speak for all intersex people. I really probably there's a lot of people with MRKH who are really angry that I identify as intersex. I actually regularly get hate mail on my website from people who have an MRKH diagnosis saying, but we're real women and we don't want to be associated with those people, which has actually been kind of interesting to me because I thought, you know, about the concept of passing. Like, you wouldn't know, most people wouldn't assume I'm intersex until I say it. I've been in situations where I show up and I'm sitting in the front row waiting to be introduced to speak, and then someone looks at me and goes, "You're the speaker?" And are really surprised. So I think, you know, it's interesting to me that many people with MRKH can pass, and people wouldn't ever know. A lot of people with MRKH who I know who have had surgery to create a vagina don't even tell their partners that they were born without a vagina. And that is really intense to me, because that's just not how I experience my body and think about it. And so I think, yeah, it's kind of messy. You know, I think, again, like, to me, the umbrella terminology, thinking of this umbrella terminology is helpful because I know disabled folks who fall under that technical umbrella but don't identify with disability, and then intersex similarly. So I think saying, you know, we're talking about the umbrellas and the medical and social views of people who fall under these umbrellas, whether or not they identify with them or not, as a way to start kind of tearing down the medicalization. So I don't know if that helps.
Thank you.
Thanks.
Any other questions?
I was wondering, what books do you recommend for academic studies?
For what study?
For academic studies about intersex.
I mean, there's a lot of really great, now that the internet has become something so many folks have access to, there are a lot of really good, like, personal narratives and things that folks have written, so I recommend that. Thea Hillman has a book called Intersex, and then in parentheses, for lack of a better word. I like that one because it's written by an intersex person. I hope to see more books coming out that actually have those firsthand experiences. But really, the internet is a wealth of information. I have the resource list that I use when I speak around the table, and they have some links to things. And if you are developing a syllabus and you'd like some more specific recommendations, you can contact me and be happy to help connect you to some information.
You can also stay for the panel this afternoon on teaching intersex, and I'm coming around, and come to our follow-up syllabus workshopping, which, if you are not teaching a traditional syllabus in a traditional academic setting, you are still welcome to attend.
Hi, I was wondering if you could speak for a moment about the fetishization of intersex bodies and how specifically, like, right now with the feminist pornography movement, there's a lot of, like, oh, representing everybody in some way, shape, or form, but I haven't seen a lot of intersex representation, and I was wondering if you could, like, speak to where you would like to see that go, if you want to see it happen, like, et cetera.
Yeah, that's really interesting. So I have a website, and I can, like, see the search terms that bring people to my website, and I'd say 90% of the hits that I get are pictures of intersex genitals or different wordings of the same thing, which really pisses me off. And I have a blog that I wrote that is titled "To All of the People Searching for Pictures of Intersex Genitals." That's kind of a rant, because intersex people's bodies often we don't feel like they're ours because medical professionals are doing things to us, looking at our bodies. I give talks, Linnell was mentioning the stupid questions. I've had people ask me how I pee, how I have sex, these types of questions, and I find that really bothersome because I don't think they would walk up to somebody who they didn't perceive as other and ask those kinds of intimate questions. If I want to talk about what my genitals look like, that's something I'm welcome to do. But I think it's really messed up when people just think they can ask those kinds of questions. A few years back, I talked to a friend. Do y'all know that, is it called Familia, that book that's like drawings from the 70s of female genitals. So I thought, wouldn't it be cool if we did a book like that that was created by intersex people as kind of a reclamation of our bodies? That hasn't happened to my knowledge, but I think it's kind of interesting. And as far as like representation in queer or feminist porn, I'm not aware of any intersex porn stars in the San Francisco cool kid queer scene. But I mean, I think that would be great to have more representation. I think the reality is for a lot of intersex people, we've been told that our bodies are shameful and we should never speak of them. That's why, people will be like, I don't understand why I hear the same 5 people's names doing this work over and over again. And it's because there aren't a lot of us doing this. And so I think there are some kind of barriers to that happening just because of the intense trauma people have gone through, but I'm all for it, so.
Hi. Well, thank you for being here. You mentioned how it really upsets you when there are panels and groups of people who are speaking on behalf of people with disabilities. And I'm curious where you see when it is appropriate to speak on behalf of somebody with disabilities and when it's not.
That's a really tough question. I don't know that I can give you an answer. I mean, I work in the disability field, and I do have a complicated history with medicalization from being intersex, as well as being in psychiatric treatment facilities as a teenager without my consent. So I have some connection to disability, but I don't identify as disabled. And so I try to be really involved with my friends who are disabled, and have conversations with them and really have them inform the work that I do in my organization. I was actually really appalled when I was hired and I went to work and I realized that there were like 2 disabled people on our staff of 12, and we are the Georgia, oh, I shouldn't say where I work, maybe, it's on film, but we are a disability organization, and so that was kind of stunning to me. And yeah, I mean, I think a lot of folks who are speaking for are completely out of touch and aren't being informed by folks who are actually impacted. So I certainly don't do that perfectly. Like all of us, it's a constant battle to work through all of this crap that we are fed our whole lives. But I try to be really grounded and open to that, and letting folks who are actually experiencing this stuff directly inform how I work. So I don't know if that helps.
No, it does. Thank you.
You mentioned how the intersex world seems to be small, that you tend to see the same faces over and over again, which reminded me that at the last conference like this I went to, I was the only intersex person in the audience. And I've noticed here there are actually more trans people in the audience than intersex. Intersex people themselves don't seem to get involved in these kinds of things in large numbers. Why do you think that is, and what would you say is the remedy?
Well, we don't know how many intersex people are in the room. They may not have flashing signs on their foreheads, so I'd say it's kind of hard to know. Yes, or any identity. So I would kind of push back on that, but I think, again, because intersex people we're told our whole lives that our bodies are shameful, that they're to be fixed and never spoken of again, that makes it hard to speak out, because most people if I walked down the street and I asked the first 10 people I saw, what is intersex, what intersex is, they probably wouldn't know. So I think it's hard to be out there when there aren't a lot of other people kind of who share that. Like, it's hard to be in the early, one of the faces of a new movement, of a young movement. I think it's difficult, and I think that a lot of folks are deeply ashamed and deeply traumatized. I don't always come out as intersex. Some days it's exhausting, and I don't want to do it. So I think it's really complicated, and I'm really grateful to the folks who created this space so that I could connect my experience to intersex. That changed my life. But not everybody is able or willing to do that. And so I think it's hard. It's hard. There's no easy answer. We have a lot of stuff that we have to undo to learn to love ourselves again, and it can be hard to talk about publicly.
I have a question that's more about disability. I was actually born with a condition and operated on when I was 8, and the complications from it actually almost killed me. But it enabled me to be able to run. And so even though I wasn't old enough to consent to the surgery and it left a lot of trauma, physical and psychological, I was still glad they did it. So I'm wondering how you reconcile a disabled person's wish to maybe not be disabled anymore with the forced medicalization of disabled people.
Whew, that's a heavy one, and I think that also is, I don't think I've ever, because I never get to talk about disability and intersex, so I've never been asked that question before, but I get asked a similar question around intersex folks who do opt to consent to surgery. I think we all have a right to do whatever we want to our bodies as long as we have the information available and get to consent to that. So I would never say that, because I have chosen to continue my life as a woman without a vagina, and I feel good about that, I would never say to somebody who chose to have a vagina created that that is wrong or that they're doing some injustice to the intersex movement. I think we all should have that ability to decide whether it's around disability or intersex. I think it's complicated. Again, I want to be really clear that I'm not trying to pass judgment or say that there's good identity or radical identity or any or less so. But I think it is important to be critical anytime that a group of medical professionals are given that much power over people's bodies and lives, and that it shouldn't just be standard. The standard is to intervene and to do surgery first, which is kind of baffling to me because from what I understand, the whole medical thing is first, do no harm, and that's not what's actually happening. So I don't know exactly how we do that, but I think having these types of conversations and starting to think, how can we think about this and articulate it in a way that creates space for people to make the decisions that they want for themselves, but also push back on kind of the standard of care. So I don't know if that helps.
I'm coming.
Run, Angie, run.
I'd run faster, but I run funny and they're filming. Embarrassed.
Hi, I'm Patrick. So I don't know if I'm going to articulate this in the right way, but I really want to thank you for talking about sort of the medical model and the insurance model around care and how that relates to capitalism and the current system in which we all sort of have to navigate in some way or another. And the idea that, typically the people of power are not the people who identify as whatever, right? So I am currently leaving a job that is supposed to be specialized in the treatment of LGBT folks, period. And it's a psychiatric inpatient unit. So there's just a lot of layers there.
Right.
Vulnerabilities. And I was the only queer person in leadership, and that kind of happened because I put a lot of work into it. I think otherwise it may not have happened, and I'm leaving it because it's not sustainable for my mental health any longer. In one way or another, I've heard from various straight ladies like preaching to the choir, like with like a hand waving me away, and you know, told to shut the fuck up, basically. And you know, 2 years of that is very, very, very hard, particularly when you're like on the front lines treating people who've just tried to take their own lives or whatever. So thank you. I just want to say thank you for bringing that up. Yeah.
Thank you, guys. Thank you.